Good morning. My name is Anne Cutler and I'm the Program Manager for the Association for the Wellbeing of Children in Healthcare. Thank you for having me today to talk to you about AWCH at the Council of Children's Nurses Professional Development Day. AWCH is a small non-government organisation funded by the New South Wales Ministry of Health. It began in 1973 when a group of professionals who worked within the system and parents were very concerned about how children were being cared for in hospital and the impact that hospitalisation was having. These were the days when parents were being kept away from their children during their hospital stay, with a weekly visit being the norm. People were beginning to understand, because of the research coming out at the time and their own observations, that there were serious consequences for children in terms of their psychosocial well-being when parents were not permitted to stay throughout what could often be a traumatic and frightening experience. Of course, children also spent a longer time in hospital by today's standards. AWCH founding members eventually decided that the best thing for them to do was to develop a policy. In 1975, our healthcare policy relating to children and their families was published as a supplement in the Medical Journal of Australia, and the New South Wales Minister of Health of the time declared it the official policy of the Health Commission of New South Wales. AWCH had achieved an acceptable blueprint for the national policy. As they say, the rest is history, and children's healthcare has changed immeasurably over the last 40 or so years. We now recognise the importance of ensuring that the emotional and social needs of children and young people are met within the healthcare system. So what are the kinds of things that AWCH gets involved in? One area of our work is around advocacy and consultation. Over the last year, AWCH has been represented on the Reduction in Radiation Exposure from CT Scans for Children Project Reference Group. Research has shown that the health impacts of paediatric scans have results which indicate increased risks related to cancer following those CT scans. Part of the project was the development of resources for parents and referrers, which you can find via the parent page on AWCH website or on the Australian Safety and Quality Commission website. Here are some further examples of other committees which we are also involved in. The Sydney Children's Hospitals Network has recently convened the Consumer and Families Advisory Council, through which AWCH and others are encouraging consumer involvement in the planning, design and evaluation of services. The take-home message today is: involve consumers early in your projects if you can, asking families, and staff for that matter, what they need or want early in the design of an emergency department, for example, will result in quite a different outcome compared to asking them what they think after you have designed the space already. You might be familiar with the STEPS program, the statewide eyesight preschool screening program, which is such an important program for picking up eyesight problems early on in a child's life. Parents have commented that if it wasn't for this program, the child's sight might have been lost, or that their child's education may have been compromised because no one would have known about the eyesight problem. We have an AWCH information resource service which includes Child Health Library. It has articles, papers, books and audio-visual material available relating to the psychosocial aspects of children's healthcare. We can also do literature searches around particular topics within our area of expertise. These are some examples of the publications that have been developed. A parent guide to hospitalisation is available in hard copy from AWCH, and you can order it over the phone. The child rights posters and charter are downloadable from our website. AWCH is also on social media, and I would encourage you to follow us on Facebook and Twitter. It's where we keep you up to date on child health matters. Check out our book reviews too, or hear from experts on our blog. We recently had a parent write about what it was like to hear and how she felt when the doctor said to her, "We suspect that your infant has esophageal atresia." Established in 1987, the AWCH Ward Grandparent Scheme supports parents and families who may be unable to stay with or visit their hospitalised child regularly, or who may need extra support during their child's hospitalisation. Now, just to give you some interesting statistics, Deloitte Access Economics, commissioned by Carers Australia, estimated the economic value of Australia's informal carers. It does make us appreciate even more these marvellous ward grand volunteers who contribute so much to the well-being of children in healthcare settings. Each year, we hold a training day thank you event for the ward grands. They love getting together and comparing how each hospital works the scheme. Depending on the hospital, there can be ward grands in the paediatric wards, maternity, special care nursery, outpatient clinics, and the emergency department. To finish, click on the Ward Grandparent Scheme picture and watch the short video about volunteering for the scheme. If you would like to find out more about the Association for the Wellbeing of Children in Healthcare and how you can support our work, please contact AWCH on 02 9817 2439 or email awch@awch.org.au.